All right, good evening, everybody. Welcome to Trusted Voices of the Community. COVID in our community, your health matters. My name is Dr. Jarvis Watson, and I am flanked and supported by Retha Fernandez, Chief Diversity Officer of Suffolk County. Say hello, Retha. How you doing? And we also are supported by State of Black Long Island, Urban League of Long Island, Teresa Sanders, CEO and President, as well as all of Sobley out there. So respect to Sobley and all the members there. This could not be done without the help of a few folks. One is one of the moderators tonight, is Adesuwa Watson, Felicia Moss, who is the creator of the great flyers that you all see when we market. So thank you, Felicia, for all your help and time from Black Long Island. And then the ACP, Lauren LaMagna, who's been making sure that people know what we're doing as far as making sure we have hosts and guests and things like that. So thank you, Laura. Devin, Vanessa Bear-Streeter, Daniel, Malika Lockhart, and Alexea Gaffney, Dr. Alexea Gaffney. Purpose of, for those who are here for the first time, the purpose of Trusted Voices is to gather trusted voices, trusted community leaders within Suffolk County to host a series of online dialogues to address the following challenges within historically underserved communities. And this is done in 3 different areas: where we are as community during the time of COVID, what is the historical significance of facing similar challenges in the past, and how do we come together? The last part is, as it pertains to underserved communities in Suffolk, and I will definitely want to say Nassau, how do we come together collectively to educate and provide resources and the best practices to these populations? Tonight we have 3 guests: Dr. Gregson Pigott, Commissioner of Health for Suffolk County, Dr. Alexea Gaffney Adams, board certified internist at Stony Brook University with a specialty in infectious disease, and moderated tonight by someone that everyone knows in the community, Adesuwa Watson, who is a program health analyst at the Office of Health for Suffolk County and the Office of Minority Health. And so before I turn it over to Retha, who will bring up a little more of the housekeeping as well as talk about the bios of the individuals who are speaking tonight. Just to give you a brief understanding of all the different topics we're going to have throughout the year. And at the end of our conversation today, we'll actually be able to let you know this calendar for up and coming discussions coming up in the next weeks or so. So I'd like to turn it over to Retha, and so she can talk about the mode of operation tonight.
Thank you, Jarvis. Welcome, everyone, to the second in the series of Trusted Voices of the Community. And Jarvis is very humble, but I just have to say that this is sort of like the brainchild of Jarvis's. So he wanted to bring our voices to the community, especially during this time of the COVID-19 pandemic. And I'm happy to be able to support him. So how our talk today is going to flow is we have our esteemed panelists, and they will proceed through a discussion moderated by Adesuwa Watson. Everyone is going to be placed on mute. We do have, if you came a couple weeks ago, you know we had over 100 questions submitted. I think we received more for this talk tonight. And so the panelists will be addressing the questions related to health and public health, because this talk is titled Your Health Matters. So you'll be placed on mute. If you have any thoughts that you want to share or any additional questions that come up, please feel free to offer them in the chat. So we will proceed. All right, I have the pleasure of introducing our guests. The first is Dr. Gregson Pigott. He is the Commissioner of Health for Suffolk County as of February 2020. He has served as the Director of the Office of Minority Health in the Suffolk County Department of Health Services since June 2009. Dr. Pigott has also served as the Medical Director for Suffolk County Emergency Medical Services. He was born in Brooklyn and grew up in Valley Stream, Long Island. He holds a BA from Brown University, an MD from Brown University Medical School, and a Master's in Public Health from Harvard School of Public Health. Welcome, Dr. Pigott. Dr. Alexea Gaffney Adams. She is a board-certified internist with additional subspecialty training in infectious diseases. She previously worked as an infectious diseases consultant at Stony Brook Primary Care and Stony Brook University Hospital. Dr. Alexea Gaffney Adams received her undergraduate education at Fisk University in Nashville, Tennessee, and received her medical education at SUNY Downstate Medical Center in Brooklyn, New York. And moderating the discussion tonight is Adesuwa Watson. Adesuwa has been with the Suffolk County Department of Health Services Office of Minority Health as a health program analyst since August of 2008. In this capacity, she sits on multiple committees and is a coordinator and educator for several community-based initiatives which address health disparities, health promotion, and community collaboration. She holds a BA in psychology and a master's degree of public health in community health and social behavior from the State University of New York at Albany. And again, this series is important for us because we are focusing on equity and centering equity with the awareness that there will be different paths to equity for different groups. And we have a responsibility to lift that up on this call and in whatever rooms we are in. So I'll turn it over to our moderator, Adesuwa. Thank you.
Good evening, everyone. I hope everyone can hear me because I'm soft-spoken, but thank you so much for joining me this evening. And I want to really give a shout out of gratitude to Sobly, State of Black Long Island, for putting together these conversations, trusted voices in the community, and coordinating these important conversations around equity and inclusion. So just to give you a little bit of background information on the office that I am from under the County Health Department in Suffolk, the Office of Minority Health was established or put together in 2005 under executive order to address health disparities and inequities. And we were actually one of the first counties in New York to have a dedicated office to address this issue. And so our office creates programming that seeks to increase healthcare access and information, collaborate with community faith-based grassroots organizations, increase community awareness, improve cultural competence level of our providers or cultural humility. And just recently, we are now kind of weaving into that conversation trauma-informed care, as well as collect and analyze data. So many of you who are researchers know that the data collection in many county health departments is sparse. We often get our data from New York State, but we're working on improving that and collecting data through our community-based programming. So to move to tonight's conversation, which is near and dear to my heart as a public health professional who's been in the field for over 12 years, so I'm not dating myself, but Trusted Voices of the Community Dialogue was created to not only be a safe space for us to dissect these issues, but to highlight and create solutions that move us forward. As the conversation progresses, let us think about what we can do individually and collectively to address these disturbing health disparities and inequities, and how we can center voices of social justice and health equity as we reimagine and reconstruct our communities and the systems that actually govern them. So let me set the stage for the discussion and provide context. So we all know that many people near and far have been affected and forever changed by this pandemic, regardless of age, race, socioeconomic status, religion, immigration status, sexual orientation, ability, but it was made glaringly clear, and I know all of you have seen the media stories, the news articles, that communities of color were overwhelmed by this crisis. As a public health professional in the discipline of social behavior and community health, I know myself and many of my colleagues here on Long Island and across the nation understand the impact that social determinants of health, meaning all of the factors that surround an individual, has on one's overall health and their health outcomes. So to put it plainly, your zip code can literally determine your access to quality education, healthcare, and even your life expectancy. So this is textbook inequities. It's fueled by structural and institutional racism, bias, and socioeconomic disparities. The numbers in relation to infection rates, testing rates, and referrals, hospitalizations, and death rates confirm this. During this unprecedented time, we not only have to reckon with the worst economic downturn since the Great Depression, but also our sobering reality that our nation's long history of prolonged neglect and disinvestment in communities of color has created the perfect condition for this storm. Today, I hope to hear from our presenters about why this virus has had a disproportionate impact on minority communities, as well as underlying factors that fuel these inequities, while highlighting the importance of communities of color not neglecting their overall health and wellness during this pandemic. We know that our communities are most vulnerable to adverse outcomes due to COVID-19, so we need to make sure that we're maintaining our health, and I'm so excited to hear from both Dr. Pigott and Dr. Adams. So Your Health Matters is the title of this discussion, and I believe that was chosen deliberately and intentionally, because when you look at the statistics, we often feel insignificant, like we don't matter, and the truth is we do. We've contributed our bodies, our spirits, our money, our time, our ingenuity to this nation, and we matter. We have every right to timely, equitable, and unbiased healthcare. So with that being said, it's my honor to serve as the moderator, and I want to just pass it over to Dr. Pigott, Health Commissioner for the Suffolk County Department of Health, the second African-American commissioner in its history. Dr. Pigott, can you just share with us, your perspective as a administrator at the local health department level?
So I came into this, so I was nominated for commissioner right after Thanksgiving. So it was the Monday after Thanksgiving weekend. And so that gave me about 3 months to pretty much get coached up by my previous health commissioner, my predecessor, Dr. Tamarkin. And so, just kind of hanging out with him and seeing what he did, I kind of got a lay of the land. And I felt like from day one, it's like, okay, let's go. Then February 28th is my first day as health commissioner. And, it was a nice, Adesuwa had invited me to some kind of event. She said, make sure keep my calendar clear. And I kind of had an inkling of what it was, but it was a nice welcome brunch. And she did a real nice job in putting it together. And so that was day one. At that time, in terms of the COVID crisis, we were following travelers coming in from China. That was the mandate given to us by the Centers for Disease Control, passed along through the State Department of Health. And so we'd get a list of travelers getting off planes that were coming in, resettling into Suffolk County, and just keeping an eye on them. They were under mandatory quarantine. And so we'd issue quarantine orders with my name on them, saying you do not leave this place for 14 days. And so we thought we had this thing locked down. It's like, yeah, it's this virus, it's coming from China. We got this. There'll be no issues here. And then I'll never forget, it was Sunday, March 8th. I get a call from a representative from the State Department of Health. It's like, congratulations, Dr. Pigott, you have your first COVID-19 case in Suffolk County. I'm like, oh, okay. And I'm thinking it was going to come from the West. I'm thinking it was going to be somebody that was, I was thinking town of Huntington or town of Babylon coming from west to east. Lo and behold, the case is in Greenport. All right, so it's a Greenport resident who's admitted to Southampton Hospital. And at the time, you could not get tested for COVID-19. So this is early March. And the criteria had specifically referred to travel. You had to have some kind of a travel history, particularly to an Asian country, especially China. That was really the only way you can get a test. And there were a couple of cases, I think it was late February in California, and another one in Washington State, where people had no travel history and were admitted to the hospital and had these weird pneumonias. And people were like, you need to test these folks for COVID. And they had to fight with the CDC to get the testing criteria to be loosened up. And so that one that was first positive in California was like, uh-oh, this is community spread. This person had no travel history. And so when that person that was admitted to Southampton Hospital and they tested him, it was because of that new criteria that said if you had some kind of weird pneumonia, no travel history, then you can be tested for COVID. All right, so at that time we were in what's called a containment strategy. So the thought was that we could contain the virus and keep it locked down by identifying the person who was a case, placing that person in mandatory isolation. In that particular case, the person was hospitalized. So that was, a pretty easy isolation. It's like, well, you're sick enough to be hospitalized. You're not going anywhere. And then we had to interview him, and he was not in the ICU or intubated, so we could actually talk to this person. And he identified a bunch of folks on the North Fork. And the common link was a brewery where this person worked. So I'm like, all right, South Old Town, North Fork, there's not a bunch of us up there. This is, a bar, a brewery that we don't really frequent. So this is where this epidemic is going to hit in Suffolk County. That was my initial impression based on that first case I saw. And the people that we had at quarantine based on that particular case, I'm thinking this is where this thing is heading. All right, so lo and behold, so now this is March 8th, boom, now March 10th, 11th, 12th hit. We're starting to get a bunch of hits in other hospitals, so in Stony Brook hospitals. And then there was a few elderly and then, a couple of younger white folk. And I'm thinking that, okay, well, this is where this epidemic is. I'm still in kind of that mindset that it's not really affecting the Black community or the Latino community much. And so the testing really started to open up at that point. Stony Brook had started doing this drive-by testing strategy that they were, had stood up on their P-lot. And so you'd make an appointment by phone or online. And then people were starting to get tested. And then we started mapping where the new infections were coming from. The next hotspot we saw was Huntington Station. I'm like, well, this is interesting. And at the time I was having a discussion with the CEO of Huntington Hospital, Dr. Nick Fitterman, and he said, I have a bunch of young Latino males in my ICU. And I'm really frustrated because, this population is getting hit with this virus. And it's really a situation where I'm like, well, they live in crowded environments, and we say things like social distancing, and this is before the mask wearing edict. The mask wearing thing started, I think, later in March, early April. But at the time, we were emphasizing social distancing, and so that was the first time I got a hint of disparities in Suffolk County related to COVID. So it was Huntington Station is a hotspot affecting predominantly the Latino community. And then we started noticing other hotspots cropping up. Brentwood, Central Islip, the north side of Bayshore, Wyandanch, North Amityville. And I'm like, oh boy. And so at some point the state had started monitoring, and I was asking for them, can you give me some kind of a breakdown by race on at least the tests or whatever you have, fatalities, anything. And the only metric they were able to give me was the fatalities by race, because when they're admitted to the hospital and they pass away in the hospital, the race is recorded in what's called the HERDS data set, Health Emergency Response Data System, HERDS. And so they were able to get that. In terms of tests, even to this day, I have not been able to get a breakdown of tests by race. And I can say that is because when people are getting tested, it's usually at the point of the test where you record their demographics. A lot of the times people are not asking what the race or ethnicity of the person getting tested is. And so to this day, we don't have a good data set on the actual people who are COVID positive and their race or ethnicity. By the way, that's just an aside. And so now we're seeing hotspots. We think is predominantly the Latino community. And then we started doing some messaging. So I was partnering with the county executive, Vanessa Baird Street, who was very instrumental in standing up what we called hotspot testing sites, which have been huge. So we set up Huntington Station, I believe, was the first hotspot testing site. It was at Huntington High School originally. And the idea was a lot of people were saying, well, we think we're exposed, but we have no way to get tested. And so the idea was to offer a site for testing. It was stood up by our health centers. Hudson River Healthcare was the lead provider in our health centers. And they were doing the testing. And the county, our mandate was to provide education for these folks that are coming through and getting tested. I'm just going to find the first day, April the 8th was the first day we stood up the Huntington site. We later expanded to Brentwood because we identified that as a hotspot. And then Riverhead, Wyandanch, Amityville, and then Coram came on board later, April 24th. And so that became sort of our main mode of community outreach as a county, going to these areas where we had the health centers and where we know we were reaching communities of color, because it's different now in this era. You can't go into people's churches or community spaces like it's something I would usually do. Now we're having a Zoom conference. I mean, this is kind of the normal that we're in now. But this we found was the most effective way because people were already gowned and gloved up. Adesuwa can tell her story because she works at the Amityville site for the county. But that was a way that it was safe for the people that were actually there, offering community outreach at the testing sites, people coming to us. So it's not just about getting the swab for COVID-19, but it's getting the resources that the county has to help you deal with it. And so here we are. So something I thought was affecting white folk out in the North Fork now becomes a pandemic and overwhelming Suffolk County, and now is affecting disproportionately communities of color, where 8% of the African Americans are 8% of the population of Suffolk County, but we represent over 12% of the people that pass away due to COVID-19. And so this is my frustration. This is where we are, and I'm glad to be in this dialogue. All right, thanks.
Thank you, Dr. Pigott, for that important kind of history of what was taking place in Suffolk County. Just have a question here concerning access to testing and treatment in communities on Long Island. So did you actually mention all of the testing sites that we have? And along with those testing sites, is there considerations for individuals with developmental and intellectual disabilities?
Primarily set up as drive-up sites that you would call the HRH main number and make an appointment. Although now, because testing is much more widely available, they are taking some walk-ins at these different sites. In terms of the IDD community, trying to think of what you mean. So if somebody's driving with that person in the car, then they can be registered to get the test. If the person is, ambulatory coming by his or herself, then if they are able to make the appointment in advance, or they have a caregiver that makes the appointment for him or her, then there should be no issues. It's not like specifically outreaching to that community, but we are able to offer a test.
Okay. And there was also another question that was submitted in the previous discussion of the Trusted Voices dialogue concerning why Suffolk County hasn't considered testing sites in churches, seeing as how New York City and Nassau County, they have testing sites at local churches.
Well, we as a county felt that the health center, since we had an established health center network, was the way to go. I think in other areas where they were having trouble getting access to testing and the health centers were not as robust, I think that's why the governor's office stepped in and said we're going to partner with churches to offer more testing to these communities of color. So I think we're doing a good job. If there is a church that feels that they can bring a large enough contingent of folks to get tested, we would be interested in doing that too. I passed that along to Vanessa and the county executives team.
All right, thank you, Dr. Pigott. I hope that you can stay on for a little. I know you're multitasking right now, so feel free to stay on if you can till the end.
I'm here.
Okay, thank you. So now we're going to pass it over to Dr. Alexea Gaffney Adams. I did mention initially that we really want to encourage communities of color to not neglect their health and wellness during this pandemic. And we know that many folks are saying that the next wave or the next concern that we will have is mental health issues, in addition to all the chronic conditions that we have. So Dr. Adams, we'd love to hear from you.
Sure. So I too, like Dr. Pigott, was watching COVID evolve around the world and watching it very intently, having the understanding that it would eventually touch down in New York City. And to me, if it was going to touch down in New York City, of course it was going to strike on Long Island because we have so many people commuting in and out of the city on a day-to-day basis. So what I first noticed about Long Island when the numbers started rising is that they were really rising where there are railroad stations that people come in and out of the city through. And in thinking about our population specifically, we tend to hold service positions. And so we would be those commuters traveling into the city to work for MTA, to work for corrections, to work for the police departments, to work for the city agencies. And so to me, that was very apparent. And even just looking at the numbers today in terms of where we live, the numbers are astounding. You're talking about double digits in communities that don't reflect our population, and triple digits in terms of numbers of cases where we tend to live and socialize. So that was really astounding. And we've already talked about systemic racism and the role that that plays, and lack of access to healthcare and resources and disparate care, and how that impacts us. And then if you add on top of that the stigma around mental health in our community, we have such a layered problem. So a lot of what I'm seeing in the office and what I'm combating, and what is kind of even more problematic than COVID itself, and it's huge, I'm not minimizing the impact that it's having, but my office is inundated with phone calls from people who are panicked, who are anxious, and who are having challenges coping at home, and for various reasons, fear and anxiety that is, turning into complete overwhelm. Loss of structure is also contributing to exacerbations of people's underlying mental health conditions. If your healthcare provider is not a quote unquote frontline worker, or not in an essential practice, a lot of practices are closing. And so people don't have access to their psychologists or their psychotherapists and their psychiatrists to address the exacerbation of their mental health condition. And so asking someone who is experiencing overwhelming anxiety or struggling with isolation to just, shelter in place can be very difficult and very problematic. And so that might also be why some people aren't necessarily adhering or don't appear to be taking the social distancing seriously. And so we can see a significant impact of that in our communities. So I know I've definitely been fielding a lot of calls around people's mental health, and people just not being able to access the services that they're accustomed to having in place. So I feel like more than just being somebody's primary care doctor and their infectious disease doctor, I've become their psychologist, because I won't claim to be anybody's psychiatrist. And I've been doing the oncologic workup and all of these things, because so many resources are shut down or overwhelmed. And we already are dealing with lack of access to care. We're dealing with stigma. We're dealing with rumors. Is this real? Can Black people get it? All of these things. And it's such a layered and complicated issue for our community. And then, as was already said, we are shut down and shut out of the places where we would typically gather and give each other information and give each other resources, because of the social distancing aspect of this whole crisis. So it has been challenging on so many levels. And if it's challenging for the folks in charge and the healthcare providers, of course it's going to be challenging for the people who are most dramatically affected by this.
Thank you so much for sharing that. A couple of weeks ago, when the county health department first started making, contacting folks that were positive for COVID, I got a phone call at the Office of Minority Health. It was from a gentleman who was diabetic, and he was in panic because he needed alcohol pads to clean his incision area. And because people were panic buying, he couldn't get access to this. So he called the health department, and I was able to kind of refer him to some community-based organizations. But are you finding that your patients are, not adhering to the regimens, maybe not coming in for their visits out of fear? Mm-hmm. Can you kind of explain what are the everyday going-ons of your patients currently during the pandemic?
Yeah, absolutely. So people are so afraid of getting infected with the virus, they want to stay as far as possible away from healthcare settings as they can. Um, we are taking every precaution we can reasonably take to try to keep COVID patients out of our office, but to take care of them remotely. And for people who are fearful or don't want to come into the office, we have expanded our access through telehealth platforms, as well as allowing phone call visits. Initially, telemedicine in like a Zoom-like setting was set up, but there was a lack of appreciation that everybody doesn't have Wi-Fi, everybody doesn't have a laptop or a superior smartphone, and that everybody is not technologically savvy. And so the access to care was then expanded to telephone services and allowing that to be a billable service. Because the other thing is providers we want to do the best that we can, or at least I want to do the best that I can. I can't speak to everybody else that carries the same title and the same responsibilities. But with that becomes liability. And so providers are always going to demand an actual point of access or point of care that is billable and documentable. But people, don't understand that that's available, because how do you get the message out that it's available? You're basically relying on people to call in and say, hey, I need to be seen, or I need a refill. Do I need to come in, or how do I go about that? Our Stony Brook Community Medical Network utilize some technology to actually send out text messages to the entire population of patients that each of our private practices covers, to explain that they can call and get telehealth access, or that they can call and do a telephone visit, or that it's safe to come in and that they should call to discuss that. So initially, nobody was showing up for care. And the problem with that is a pandemic that is on the forefront of everybody's mind distracts people from all of their everyday health issues, like their diabetes and their high blood pressure. And so there's lack of resources, there's lack of food. What can you buy? What's available on the shelf? Is your diabetes now out of control because you don't have access to healthy food, because you can't get to the grocery store as frequently as you would like to? Are you stress eating? Are you limited to what your children or grandchildren can bring into the household? And so I'm seeing, and I'm sure so many other people are seeing in the outpatient setting, exacerbation of so many underlying medical conditions. People's blood pressure is out of control. People are in and out of heart failure. People's diabetes is out of control. And it's a combination of lack of access to the healthy foods that they need. Sometimes people are running out of medicine for fear of leaving the house. People aren't getting their labs done because they're afraid if they go into the lab, they'll get infected there. And then not coming into the office, and I'm trying to think if I'm leaving anything else out. And then just the mental health aspect of it. Like if your mental health condition is exacerbated, you're so anxious, you're not functioning, you're so depressed, you're, curled up in a ball and you're not even taking your meds and you're stress eating. It all is a setup and a recipe for disaster. So people are either coming in and they're perfectly stable and they feel safe to come in, or people are only coming in when things are so far gone they have no choice but to come in. There's talk about where's the heart attacks, where's the strokes, where's the this, the that, why aren't these things showing up in the ER? Are they fudging the numbers or whatever? People are afraid to come out, really afraid to come out. And it's only that they call seeking medical attention. If it's not appropriate in the office, I have to kind of coax them into the emergency room, but it gives me an opportunity to explain to them why it is safe, because COVID patients are being cohorted away from the general population. Everybody's getting tested anyway, so you pick up incidental and asymptomatic cases. And, unfortunately, there's just not a way to sound all of this information for everybody to hear. It requires people to take action and reach out to us, but it overwhelms our offices and our health systems as well. So we absolutely need some sort of a platform for these kinds of things to be explained in a way that everyone has access to, so that, you know, I can spend more time taking care of patients and not having the same conversation 50, 60, 100 times a day.
Thank you so much for you know, highlighting what Stony Brook is doing and what you're doing as a provider. Just to piggyback off what you said, so I'm going to take it to the county level, because I think many folks are receiving messages from our larger health institutions like the World Health Organization, the CDC, but we often don't know what our local health department does. So Dr. Pigott, can you shed light on how the county health department is actually getting this message out, especially to our most vulnerable, you know, communities like our seniors? We have our indigenous communities, which often, you know, kind of are operating in silos. And so how are we engaging all of our community members, you know, those on the Shinnecock Reservation, those on the Puspatuck Reservation and Massac Shirley, our seniors, even those from undocumented communities that oftentimes are not literate in their own language? How are we relaying these messages so that they're clear, concise, and it's not confusing?
So one of the things I did early on was record some PSAs. We did a set in Spanish and another set in English, but it was really discussing social distancing, maintaining at least 6 feet of separation. At the time, I believe we talked about face coverings, so I had to recheck, so it's been a while since we did that. But getting those out there were robocalls actually that had my voice recorded on it in different areas where we were setting up the hotspot testing. Could we always do more? Yes, because I know it's just, from where I sit now in the commissioner's chair, there's just too many things coming at me. But ideally, you know, my minority health days, I would be out in the community actually doing some of these things myself and going to different venues. But I'm always open to more ideas in this different age where everything is remote, of things that we can do more. I know there's a lot of traffic on Facebook, a lot of people that share different articles and different tidbits and knowledge there and other social media. But yeah, I'm always willing to do different other things to help.
Thank you. And just to share from my perspective, so most of the week I'm out at one of the testing spots in Suffolk County, and one of the things that we you know, believed was very important, and this came from our county executive's office, is not to just have the testing made available, but to provide a resource guide. So at each of the testing spots, we have a community educator, we have an outreach person that is speaking to the community members, and oftentimes you'll find that they have other social needs. Some of them are concerned about their employment, many of them are trying to access food. And so just to have the resource guide and to let them know that we have a 311 number that you can always call for your non-emergency needs is so important. Even just providing the hand sanitizer and masks, sometimes when we have these messages that go out, it's a broad assumption that everyone has these items, and that's not the case. So the small resources that we can provide are really beneficial. So, you know, we're kind of running down in time, and I'd like for us to kind of get to some solutions on what we can do so that we're ensuring that we don't end up in this predicament when we have another pandemic, because it's not a question of if, it's a matter of when. And so Dr. Adams and Dr. Pigott, you can both jump in. What are some ways that we are ensuring that there's equity in medical care, medical access? What are some of the things that you're doing as a provider under one of the largest health systems in the county, and Dr. Pigott as health commissioner at our local health department?
So one of the things that's so important is just to have a primary care doctor and to have someone whom you have a good therapeutic relationship with. What I've noticed and what I've seen at the university level and in working with the hospital team is, you know, the care has been across the board consistent. And specifically, I can speak to the infectious disease team and the staff. And, you know, there's specific commentary on, you know, 40% of our hospital population right now is Hispanic and Latino. and making sure that not only are we addressing COVID, but considering other issues that they might have, and not because the world is talking about it, but because we understand the population that we take care of. So in treating COVID and some of the types of medications that we use that suppress the immune system, you know, we're thinking we have a large South American population, and we're suppressing their immune system to help this virus. We need to screen them for TB. We need to screen them for parasitic infections, because we can overwhelm their bodies with other infections if we're not mindful. And it's only that the team is, you know, just choosing to be conscious of who the patients are and what their baseline risk factors are and how our treatment of them may impact them. And let's anticipate it, and let's educate the primary teams and the floor teams and the internists and the surgeons who are running the ICU, who never think about these things, to, you know, make sure they look at their patients. And if they're not getting an ID consult, let them know, hey, you're Latino patients, your Hispanic patients, your Spanish speaking patients, however you're going to identify them, need these specific tests. And, you know, being sure to say, if your patient even just has borderline high blood pressure or borderline blood sugar, they may be diabetic, they may not have access to healthcare. They may not walk in with these diagnoses because they don't have a primary care doctor or provider, and these conditions haven't been identified. If you even suspect them, and you should be suspecting them based on race, based on culture, based on where somebody lives, because we know that the systemic issues basically result in us being overweight, obese, hypertensive, diabetic, etc., lacking access to healthcare. So we don't really know that somebody has no past medical history. Take that into consideration, work it up, and understand what your patient's risk truly is. So I get to work with folks who are cognizant, but I know that that's not true across the board. And so the only way for us to really ensure that we are being really adequately taken care of is, you know, to find providers with whom we can have a good therapeutic relationship. And we only make up 2% of all doctors around the country. So the 13% of us are not all going to get to have a Black doctor, but if you know one and they take great care of you, well, refer your family and friends, because I have patients who are all over the place, travel from Nassau, travel from Brentwood, travel from Belport and Riverhead to see me. And when I ask them, you know, isn't this a little far for you to travel to see a doctor? They're like, no, it's too far to go around the corner to the person who doesn't really take care of me. And so also to get the word out about providers who do provide great care to us. And it doesn't have to be at a university hospital. It might be a private office. It might be, you know, the Quorum Health Center. It might be the Brentwood Health Center. It might be any of our community centers, because we have some great providers out there. It's just a matter of us connecting with them. And then it doesn't become this stranger who now in desperation is just flooding in to see me. It's my cohort of 2,000, 3,000, or 4,000 patients, sometimes doctors have, who is reaching back in a time of need, and I can communicate with them. They can be a part of that text message blast that goes out and says, hey, we're still open and we can help get you tested. So just before I stop and let Dr. Pigott speak, I know that now we've been given the go ahead to just write scripts as we feel it's indicated to send patients to the various testing sites around the Suffolk County area. So if people are getting linked up with primary care providers or already have one, then they can get tested. There's a lot more access because there are kits available. We had to be very judicious in the beginning and mandate that people have symptoms or a contact or foreign travel, because we didn't want people just randomly getting tested, because other folks will just use up resources just because they can and out of curiosity. And so in the beginning, testing was very limited to specific populations, but now we're looking to get more population data, really. So your primary care doctor can write you a script and you can go to many of the county testing sites at this point. And then one last thing to say, like if you are fearful or if your people can't get out of the house because of COVID, now you can do an initial visit with a provider as a telehealth visit or a telephone visit, whereas prior to COVID, you had to come into the office, establish care, and then you could only follow up by telehealth or telephone visit. So a lot of things have shifted to allow for people to get access to care and get access to testing, and we just have to get the word out as to what is available to our community.
All right, so I just wanted to paint a picture of where we were and where we are now. Overseeing a local health department, I have to focus on the big picture. And when things were at their worst was late March, early April. So at the time, we were getting about 100 to 120 new hospital admissions for COVID-19 on a daily basis. The hospitals are overwhelmed. This is all 11 hospitals that we have in Suffolk County, just overwhelmed, having to turn, anesthesia beds and labor and delivery beds into COVID units. It was really bad. So by April 10th, the hospital census was at its highest. So that was 1,658 people in the hospitals at that time. We were getting positive test results, positive COVID results by the thousands. So, a few days in a row, we were like 1,100, 1,500, 1,300. And so at that point, this is after we had started to put everything on pause. That's when the Governor Cuomo announced that the schools were closed, the bars and the restaurants were closed. And so the idea was just to cool off the epidemic globally. And so where we are now, I'll give you May 20th, it's yesterday, 425 COVID patients in the hospitals. So we're down from a high of 1,658. The intensive care unit, 131 yesterday, down from a high of 562 on April 14th. 105 using ventilators in our hospitals, down from a high of 477 on April 9th. And in terms of the positivity of the tests, so at that time, when I was talking about the first week of April, all the tests we were doing were about 47% or so positive. Right now, yesterday's numbers, we had 142 positive tests in over 3,600 tests, and it was about 3.9% positive. So we've successfully started to pretty much cool off the rate of transmission of the virus, and now begins the work of trying to get the economy reopened. And now we're switching our strategy, whereas initially when I was telling you about the case in Greenport, we were containment minded, thinking that we could contain the virus and prevent it from spreading, realizing that that was not going to happen because the virus had already spread. The horse already left the barn. Now we're trying to get back to that level. So we were doing mitigation. So in other words, because we had 1,000+ new cases a day, we could not mandatorily isolate people. All you could do is try to reach out to them, contact them, say you tested positive for COVID. At this point, we would like you to isolate yourself at home, have no contact with the outside world, et cetera, and tell your close contacts that they should be under quarantine. So there's no mandatory nothing. It was just pretty much, the bare minimum in terms of contacting people. We want to get now to the stage where we are hiring a bunch of contact tracers, and so that when we get a positive, we can really drill down into, well, who did you really have close contact with? And were you, social distancing, were you wearing a mask? Are these legitimate close contacts? And then really issuing mandatory quarantine orders at that point, and getting back to that stage where as we start to open up the economy and people are out and about, that they're not spreading the virus. And so in that regard, I think now is kind of, where we feel like we have control over this thing, and what we do will dictate, where things go in terms of reopening more things. Because like the bars and restaurants are like the last thing to open. The churches, they just now said you can have up to 10 people in your church. You have churches that have a regular attendance of 200 to 300, and you're only going to pick 10 people you're going to have church with. I'm like, what can you do with that? I mean, it's better than what you had. Or if you have a big parking lot, then you can have a drive-through service. You put up a couple big screens and an amplification system and have people in their cars having church. So we're not there yet. I think the messaging is still key. In terms of access in Suffolk County, I think the hotspots have been tremendous. When I was talking about the rate of positivity, so overall, it's about 4% of the tests are positive, but if you look at the hotspot sites, we're still in the 30s. We're still about 35% of the tests in the hotspot sites are positive. So again, to read them off, so this is Huntington Station, Brentwood, Riverhead, Wyandanch, Amityville, Coram, Southampton, and then also Greenport in Norfolk. We started doing hotspot testing there. So we're still doing that work to try to drill down into these communities of color, which are still have higher rates of spread of the virus than other parts of the county. But that's where we've been focused as a local health department, and how do we successfully reopen? Because now we have all the summer itch and people want to get outside. And, Memorial Day weekend, everybody's like, oh, can we go to the beach? In Suffolk County, you have to be a Suffolk County resident, because they didn't want a bunch of, since the city's not reopening their beaches this weekend, we had a fear that a lot of people would be traveling east to go to county beaches. So we wanted to kind of nip that in the bud. But this is going to be, we're going to be doing this for a while, folks. I think the word is out there. People understand what social distancing means. People understand what wearing face coverings in public means. So I think that has gotten out there, even in communities of color. But it's just, we still need to be very cautious in how we proceed from here on out.
Thank you so much, Dr. Pigott. I think we're coming down to the final minute, so I just want to pass it over to Retha so that she can kind of get to some of the questions in the chat. And please feel free to also leave additional questions in the chat. Anything that we can't get to today will be sent to both Dr. Adams and Dr. Pigott to address at a later time. So Retha?
Oh, let me unmute. Okay, thank you. Thank you both. I just wanted to go through, because this forum, there's always such great comments in the chat, and then some questions. Martine Hackett said earlier, lack of data on race and ethnicity is very common in many different health contexts. And Teresa says, when white America gets a cold, Black America gets pneumonia. And then kudos to Suffolk County for setting up those hotspots when we did. Dr. Pigott, there's a question about hotspot testing in Central Islip. Do you know of one that you can mention quickly, or maybe that person can go to the Suffolk County Gov website to find a location?
Central Islip in particular, I'd say go just next door to Brentwood. That is at the Brentwood Recreation Center. That's what we're doing, that Brentwood site. Other than that, now, a lot of the urgent cares are offering hotspot testing, your City MDs, your Go Healths. Testing is much more accessible now than even a month ago. So I wouldn't, you should be able to get testing now without too much of a search. It's not like it was. It's much better.
Okay, great. Thank you. Veronica mentioned that we need to focus on community health education now. So that's a good policy area for us to explore. Bringing students into the conversation. Thank you, Martine, for that. I know Jarvis was all on top of that. And yes, communication between Nassau and Suffolk does happen, informally with like people that are on this call and through organizations. But how can we get that bi-county relationship more official? Dr. Alexea conducts some cultural engagement sessions at some of these major hospitals, especially because everything what you were saying about the culturally competent service is so necessary. Angela asks, is there a directory of culturally competent medical professionals on Long Island? Anybody know if anything like that exists?
I don't know if there's specifically a directory on Long Island. I know there's blackdoctor.org where Black healthcare professionals can sign themselves up. And I would just do a search on any sort of Black medical professionals. I will reach out to my community of physicians and see if anybody knows if there's specifically such a directory for Long Island, because if there's not, there should be.
Okay. Yes, we will be sharing these resources on the YouTube page, on the State of Black Long Island SOBLE page, and also in email. So yes, it will be posted and shared. Question about contact tracing. If Dr. Pigott or Dr. Alexea Adams knows if contact tracing has had an impact on the decreasing numbers.
No, not yet. To be honest, we haven't really started doing it yet. We're still in that damage control mode where we're getting over 100 cases. We're getting to ramp up the contact tracing probably by the end of next week.
Okay. And is the testing that's happening free? There's a question.
The Hudson River healthcare sites, those are free. And the Stony Brook testing site where you register with the State Department of Health, that is also free. The urgent care sites are going to want to bill your insurance. The test itself might be free, but they're gonna want to charge you for an office visit, maybe some kind of specimen handling charge. They're gonna try to tack on stuff, so you have to be careful about those.
Okay, and what about antibody testing?
That's another, yeah, Northwell's doing it for their employees. County employees, they had to offer that to us as well. That's a whole separate discussion. You want to go into the significance of antibodies?
Yeah, I was going to say there is antibody testing more widely available. Stony Brook is also testing its employees, and I, as a provider, can order testing for my patients. But what we don't want is people to get a false security of, I have antibodies, it means I can't get it again, because we don't know that. We definitely have seen cases of people who were symptomatic, tested positive, resolved their symptoms, had a negative test, became symptomatic again, and tested positive again. It's not a huge number of cases that I'm aware of, but that it's happened at all means that, you know, we can't rely on antibody positivity to say that I'm safe and I don't need to continue to socially distance. So even though antibody testing is available, that would probably need to be ordered through a provider. That is not likely as easy to get as it is to get the nasal swab to see if you're actively infected. But it doesn't mean that you don't have the infection now. It doesn't mean that you can't get the infection again in the future. So people have to understand what that test means. It means you've been exposed to COVID-19. The tests that are available are specific to COVID-19. It's not going to test positive because you had the usual common cold coronavirus that we see annually.
Thank you. And then one last question. Any comment or any new info that we have on children and how children are being impacted?
So one of the issues I had with the language around COVID when the infection first touched down in the United States was that this idea that only people 65 and up could be impacted. And I think what they were saying is that's the most vulnerable people and the people who are going to most likely have complications, but that's not the message that was received. Children are being infected with the virus, and although many of them are asymptomatic, it is not zero. We're seeing children and teenagers succumb to this infection. We've seen children needing to be intubated or needing oxygen support. Our PICU had several cases of all ages impacted by this virus, and then now we're seeing this Kawasaki-like syndrome. So the high fevers, the rash, the peeling skin, and that's coming weeks after the children have been impacted by COVID. So we're just going to continue to learn as we go, because some of the impacts are time dependent. So they think that this Kawasaki-like syndrome is occurring about 4 weeks after the children initially got infected. So some of them aren't even testing positive by nasal swab when they're displaying these symptoms. So in a situation like that, that's where antibodies would be valuable. If you think your patient is having some sort of consequence or sequelae, or if your family member or loved one is having unusual symptoms and you're not certain if they had COVID preceding that, because we're seeing heart conditions and strokes and blood clots and all sorts of consequences of the infection after people have gone through that phase of fever and respiratory illness. And so antibody testing might be valuable in terms of saying it's a consequence, or that they had COVID and there's a risk factor and they need to be watched more closely if they display any cardiac or heart symptoms, if they display any neurologic symptoms or stroke symptoms, or if there's a rash or, any other concerning symptoms. We might have to reach back so that we can continue to document and we can continue to learn about this virus and what it can do to us moving forward.
Thank you so much. Just one last comment and then I'll turn it over to Jarvis. Teresa Sanders, who is on the call and who is the president and CEO of the Urban League of Long Island and also runs the State of Black Long Island Equity Council. She is on the governor's Reopen New York Advisory Board. And so she's asking if you could, any ideas that you have related to safe reopening or any ideas, email them to her so she can bring it to that table that we are so fortunate for her to be at. And her email is tsanders@urbanleaguelongisland.org, and I'll put it in the chat too. Thank you, Teresa. All right, Jarvis.
All right, thank you all. First of all, oh, I think I got a little echo. Thank you to Adesuwa for moderating such a great conversation. Thank you, Dr. Pigott and Dr. Alexea Gaffney Adams, for, I know it's so extremely busy but you all took time out to make sure that you gave back to the community. And hopefully, like I said, some of these questions or some of these topics that we have, we can bring back to you at another time and share with you. And just like Retha said, we will be able to share this on our YouTube channel, which I'll share in a second. Okay. And I just got a word that the other question is, what can we do individually and collectively as a community to make sure we were coming together? I think I've seen a number of different suggestions about having a centralized location or some type of information sharing, instrument of some sort. So that's something we could definitely look into and start to create. And we definitely were looking for people to come to the table to kind of help us understand and make sure there are certain people that need to be at the table to be a part of that sharing and information giving. The upcoming dialogues that we have are, the next one's on June 4th, and this is really a bi-county dialogue, COVID-19 and policy impact. Because if we're not talking about how this is changing policy, then we're just talking. So once again, we want to make this a situation where we're moving in a forward direction collectively. LGBTQ is coming up next. After that, domestic violence. We want to make sure that we are addressing all underserved communities. K-12 education, we're having a big thing with Soberly in regards to what's happening with COVID and education and our young people. And I know that Martina talked about that a little bit. Indigenous communities, that was brought up earlier. So we have some people from Shinnecock, hopefully Unconchug, that can come out and talk about what's really happening on the reservations out there. And also higher education. We really want to talk about what that move is, because for those that are in K-12, eventually, hopefully the end goal is higher education. And we want to talk about what's happening there and how can it become more K-16 as opposed to K-12 and higher ed. So if you want to find out a little bit more about what we're trying to do, like I said, some of the stuff, a lot of things that we do is going to be on the State of Black Long Island website, as well as a Trusted Voices of the Community YouTube channel that we have, and which is the first show is actually on there right now. And then in a couple of days, we're going to upload this one. And if you ever need to email us about anything, any additional questions or ideas that you have or any upcoming shows, please reach out to us at trustedvoices20@gmail.com. And we just want to say we are so appreciative for the people who stayed on, appreciative to Retha, Teresa, all those people who helped out and continue to help out. Please be safe. I think that is something that we need to say frequently, but also mean it. And please watch your movements out there. But thank you for being with us today. And we can't really express how much this is really going to help save a lot of lives out there. So thank you. Be safe. travel safely to your next destination, even if that's in your next room in your house. But thank you all, and we'll be coming back in a few weeks. All right, take care.
Thank you. Thanks, everyone. Thanks for being with us.
Thank you, and thank you, Jarvis.
All right.